My name is Sage, and my presentation is on herbal and integrative treatments and periodontal therapy. The purpose of my study is to evaluate how herbal and integrative treatments support the management of gingivitis and periodontitis. I had 3 key objectives. The first was to explore herbal and integrative strategies for periodontal treatment. I wanted to see how the role of plant-based and natural therapies can be complementary when it comes to doing traditional care, conventional care such as an SRP. I wanted to evaluate how these strategies contribute to reducing inflammation, plaque, and microbial imbalance. I focused on 3 plant-based remedies such as turmeric, clove, and green tea. Why did I choose those? Well, those are commonly studied herbs already that are known to have oral health care benefits alone, but not just with the SRP, so I wanted to see how they worked with an SRP as well. And then I wanted to look at the clinical relevance and therapeutic effects. I wanted to see the reduced gingival inflammation, bleeding, bacterial activity, key things that we're looking for when we see our patient back after we do an SRP. So where did I get my information from? I got my information from a bunch of different sources. I looked at randomized controlled trials, systematic reviews, and clinical case reports that were published between 2022 and 2025. Well, why did I make sure it was so recent? Well, things are constantly changing in the healthcare field and in dental care as well. As we know, it's recommended to use a certain amount of bleach after treatments and to rinse our mouth out with it. We have new information on chlorhexidine. Things are constantly changing. I didn't want anything that was 10 years old. I wanted to keep things from now, this current time period in 2025, and no more than 2022. So keep it in the 3-year range. I looked at experiments, and then I looked at data from peer-reviewed journals and clinical reports. I looked at the Journal of Periodontology, the International Journal of Dental Hygiene, PubMed, and I chose these because these sources are relevant. They are quality, and they also they emphasize evidence clinical-based outcomes. So the first key herbal agent that I looked at was turmeric. Its clinical relevance is that it's anti-inflammatory, antimicrobial, and it's an antioxidant. It comes in 3 forms: gel, mouthwash, and powder paste. Next, I looked at clove. Its clinical relevance is that it's a natural anesthetic, a natural antiseptic, and it reduces pain and inflammation associated with gingivitis. In addition, it disrupts bacterial cell membranes, and it comes in multiple forms. Some is essential oils, a rinse, and a lounger. And then the last herbal agent that I looked at was green tea. Its clinical relevance is it's a potent antioxidant. It has anti-inflammatory effects. It inhibits the growth of our bestie, gram-negative anaerobes like P. gingivalis, and it improves clinical attachment levels in chronic periodontitis, which when we do an SRP and we see our patient, one of the first things we do is a full mouth probe, an FMP, because we want to see what clinical attachment gain we've got from when we did our SRP. It comes in multiple forms as well, such as a mouthwash, gel, or capsules. So what results did I find? One of the first results I saw in my studies was there was a reduced gingival inflammation. Patients that received an SRP in addition to a 1% turmeric gel saw that there was a 12.3 reduction in the gingival index. There was a decreased bacterial load. Patients that use that use green tea mouthwash reduced P. gingivalis levels by 45% and reduced plaque index scores by 38% in 3 weeks. There was anti-inflammatory and antioxidant activity using green tea and turmeric, decreased pro-inflammatory cytokines, and significantly lowered antioxidant stress markers in periodontal tissues. All these effects were things that happened with an SRP. They were not alone. And there was a greater reduction in probing depth, clinical attachment level when compared to an SRP alone. And then the herbal rinses of neem, clove, and green tea also had very similar reductions when it came to using chlorhexidine. There were similar reductions in plaque, gingivitis score, but there was no staining and there was no altered taste reported. So it wouldn't really be a fair study if I only talked about the positives. So some of the negatives and limitations to keep in mind is that these studies were taken between 2 to 8 weeks. So it was short, we don't really know long-term effect. The sample size was small. There was no more than 100 participants, which kind of gives it, it's harder to figure out how it would affect a large population. And there was really no standardization. The formulations varied widely. One study was using 1%, one was using 5% turmeric gel. Some used mouthwash, some used powder paste. So using the different concentrations in the mouthwash recipes makes it hard to compare results or to set a clinical guideline and say, yes, this is the golden standard, this is what we're gonna do moving forward. The key takeaways though is that no matter what, the studies show that there is a significant anti-inflammatory and antimicrobial effect and antioxidant effect when we're using those herbal remedies in addition to an SRP. There was a reduced plaque and gingival inflammation, improved probing depth and clinical attachment level, and there was lowered biomarkers and inflammation. Why might someone want to use these things though instead of our standard, what we always do? It's appealing to patients that are looking for natural alternatives, those that have sensitivity to chemical agents. You know, sometimes it's already hard enough getting someone to use fluoride, so I couldn't imagine after they've had an SRP, they're not always going for, yeah, I want to use this mouthwash. So it's important to have options for our patients so that we're catering to everybody. And practices that are looking for preventative and wellness-centered models, it can also be beneficial to them. We want to make sure that in the future we have long-term studies to confirm safety with extended use, standardized dosing and delivery methods, and we want to be able to compare herbal agents head-to-head with traditional antimicrobials. So when we present this information to our patients, we're not like, oh yeah, I heard this is good, but we want to make sure, hey, this is in conjunction to their standard, something on the market, it works similar, if not better, or, you know, it might not work as good, but it works. So if you have a sensitivity, if you don't like if you don't want to do chemicals, you want something natural, and you don't like the taste and the staining, this could also be beneficial to you instead of just only using our SRP. These are my references that I used. You can scan my QR code to see them. That's everything. Thank you.